In this video today, we're going to talk about if you've had one compression fracture, how to stop from having another compression fracture. For those of you who have had a compression fracture, you know that it can be painful, it can be incredibly uncomfortable, waiting for it to heal or having a procedure to try to be able to improve the underlying problem isn't necessarily always the easiest. So what can you do from keeping this from being a continual over and over or recurrent episode or event? That's what we're going to talk about today. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand their physical health, their mental health, how to be able to optimize for getting the very best you possibly can, and knowing, more importantly, your options, all the options on the table, so that way you can make an informed decision for how to be able to live better and live longer. Today, we're talking about if you've had a compression fracture, what else can you be able to do to prevent it from coming back? Very seldom do most docs tell patients that once you have one compression fracture and you have it repaired, that the likelihood that you have another one is pretty darn high. And so why is that? When you have a compression fracture, as you very well know, it looks a little something like this, where you have this kind of shallow scalloping that's down here in the top portion. This is a picture of the spine, as you very well know. On the right-hand side is the spinous processes, and the center of the spine. Off to the left-hand side is the aspect of the intestines and such. This highly bright white coloration is the area of the cement or medical grade polymer that was put in place to be able to try to make it stronger. And this demarcation is showing kind of that anterior wall or the front portion of the spine. The interesting thing, though, is that this component that's present with the area of the cement that's present is that cement is normally heavier than the bones that surround it. And so when you look at the bone above, which looks perfect, and the bone below, which looks perfect, those bones can eventually have their own compression fractures that can occur and can result in you having a kyphotic angle that can occur. In this picture, we see the original fracture, but if you look a little bit above it and a little bit shady, you can see a little bit of a dip that's present. So what we don't want to have is another aspect of a kyphotic continuing to worsen progression of compression fracture above compression fracture above compression fracture. But let's take a step back and see, is there another thing that can be able to be predictive besides the aspect of the strength of the bone? For most people, they're like, oh, you know, this compression fracture, I really felt it and I just don't really want to feel it again. Where do most compression fractures happen for most people? Well, it's traditionally in the area that's the lower area of the thoracic spine and the upper area of the lumbar spine. So as you can see from this picture, it shows that many of them occur at T12, T11, L1, L2, and somewhat within the lower spine with a combination of L1 and 2, and sometimes a little bit higher up at T9. So what does that mean? Those areas are pretty close to where the ribs either stop or kind of have their lower border. And when we look at that, it can affect our pulmonary function and how well you can be able to breathe. And so it can give you issues even when you're in a seated position, not just in a standing position alone. So what's one of the ways to be able to deal with this? In our other video, we talked about how you might be able to diagnose it by feeling it and pressing against that aspect of the spinous processes. Well, that spinous process does not exist without anything else that's around it. Frequently, it exists with muscles that are present there. This picture is going to look a little odd because it has a redness that highlights it, but it's a picture of the areas of that aspect of the spinal process, and more importantly, the muscles that surround it. So when you take a look at the areas of vertebral body that we've shown before, and we can be able to see this in relationship like this, the things that sit here are muscles. And that those muscles provide support. So when we look at this picture, we can see this area of muscles that exists to the left-hand and right-hand side. And the reason for the area of this coloration or this redness that's present is because what we're looking for is to see how much of that area is really muscle and how much of it is fat. So one of the things that we can see highlighted with the area of the circle is this component of fat infiltration that takes place into the muscles that should be a stronger supporting element of the spine. When we have fatty infiltration into the areas of the supporting muscles, it makes those muscles more likely to be weak and makes it more likely for you to have a fracture moving forward. So what you want to be able to do is to strengthen those muscles in addition to being able to take medications, which may be able to prevent you from having further fractures. So normally when I talk to patients about being able to improve their musculature strength of their back, they think about many of the muscles they think about when you're either doing activities or bodybuilding or things like that. So you'll see muscles that'll come up like this, or you'll see things that look like the rhomboids and the latissimus dorsi and trapezius and those type of muscles, which are great muscles to have. They do have an impact on your strength and your ability to be able to sustain posture, but those aren't the muscles that we're talking about. So what are the muscles going to prevent you from being able to have this subsequent or repetitive compression fracture? Well, if we look in cross section, we can see it. Different than what we have in that red highlighted, but it's really going to be muscles like the rectus spinae and multifidus. So what is that in regular English? If we were to cut this down and look at a cartoon and we take a look at the back, we can see there's a whole host of muscles that sit right by those spinous processes, those little white knobs that you can see right in the middle of this picture. And we do a blow up picture, we can see that there's muscles that provide structure like a lattice or a net, or the aspect of a ladder, if you would. What we want to be able to do is to be able to improve those muscles. So what many people would say is, well, so what are the exercises I can do for that? So that's why you came here. So if you find these next few things helpful, please hit the like and subscribe button and give us an element of comments of whether this is something you think you can do or can't do. For those of you who are a little bit flexible, and I know not everyone can do this, and I'm not telling you to do this immediately after a fracture. One of the things to look at is something like a cobra pose, where you can have that ability to be able to have some degree of hyperextension. Now, this is an extreme in this cartoon and picture. We don't want you to have that amount of significant hyperextension. And the main reason is because that can cause more stress on the back. But what we do want to do is to have you actively engage those muscles that are present within the aspect that surround the spine. If you can engage those muscles and do it with consistency, you can be able to change that fat to muscle. And that's what we're looking for. One of the other ways to do that is something that's called a bird dog position that looks like this. So if you were to take a look and you can see that one arm is lifted and the other arm is low. And what many of my patients will say is, Dr. Landrum, I'm 70 years old. I'm 80 years old. I'm almost 90 years old. I can't do these type of positions. Well, you don't necessarily have to get down on the ground and do it exactly like that. You can use a ball. You can use a piece of furniture, which doesn't require for you to be able to do everything on your hands and knees. You can find a soft surface and do it incrementally in order to be able to improve your strength and improve what you're looking to be able to get, so that way, that 1% better can help you get 1% less likely to have a fracture. And by doing it with repetitiveness and over time, you can be able to take back your control of how you feel and how you're going to feel continuously going forward in the future. If you found this video helpful, like I said before, hit the like button. It helps us be able to reach other people that this might be important for. If there's comments that you'd like to be able to add about how this will work or other things that you've done that have been able to be helpful for you, please add them. If you're interested in learning about more videos like this that can be able to help you know your options, help you be able to live longer and live better, how to be able to stop pain, put your mood in a better place, and let you really be able to do the things that you want to be able to do, hit subscribe.